Hello everyone from South Korea. I'm Dr. Wu Pang Hong from Singapore. I'm a consultant orthopedic spine surgeon in Ng Teng Fong General Hospital, National University Health System Jurong Health Campus. I'm also an adjunct assistant professor in Yong Ru Lin School of Medicine, National University of Singapore. Currently, I'm practicing as a 100% spine surgeon in my hospital. This is one of the places that the local have local food. We call it a hawker center in Singapore. It looks like this is an open space with lots of stores and seats in between the stores that allow us to buy from different hawkers and enjoy the food all together in one common space. We have many favorite local food. One of the most common favorite local food is that of the Hainanese chicken rice, as you can see from here. This can be easily purchased in the hawker center and enjoy in the food in the common space table. We can find Korean and Japanese food in the hawker center too. You can see that there are many types of Korean and Japanese food here. Another famous local hawker food is that of the fried Hokkien mee. As you can see, it's fried fresh, and then there will be a long queue usually. This is the external look of Ng Teng Fong Hospital. This is Tower A, which consists of 8-story building. Most of them are run under clinic. There's a link bridge linking to Tower B, which is essentially an acute bed hospital. 700 beds are available in this space, and followed by a link bridge that links to Tower C, which is our community hospital. As you can see from the facade of the hospital, it is heavily linked with various roads leading to the hospital and an MRT that's right behind the shopping center jam here. Overall, Ng Teng Fong General Hospital look after patients in the western part of Singapore, which consists of about 12% of Singapore's population. Welcome to Ng Teng Fong General Hospital, part of the National University Health System Jurong Health Campus. This is a hospital with 700 acute beds and 400 community bed facility hospital. This hospital treats all kinds of general conditions, from general surgery, orthopedic surgery, spine surgery, neurosurgery, as well as medical conditions. There are 3 towers, Tower A, Tower B, and Tower C respectively. Each of them is linked by a link bridge and is linked to the MRT. In these community facilities, we have inside our hospital is a hybrid system where there is shopping centers linked to our hospital by the link bridge, and a mass rapid transport linked to our hospital within walking distance. Helps to facilitate our patients and in commuting to our hospital. This is Tower A. We are walking towards Tower B. It's about 5 o'clock today. We have just finished a clinic. We typically see about 60 patients per day in the clinic. I'm a spine surgeon, so most of the patients come in with spinal conditions. This is a travelator. I'm traveling from Tower A to Tower B, where my office will be, and the block for the inpatient bed.
Hello, Dr. Wu. Good afternoon. Welcome to hospital.
Thank you. This is the MRI of the patient, a 43-year-old patient who had come in presented with acute cauda equina syndrome, urinary and bowel incontinence. You can see that there was a right sided and centrally based prolapse intervertebral disc in the lumbar 5 sacral 1 region, occupying about 80% of the spinal canal. This patient underwent an endoscopic procedure, right-sided interlaminar endoscopic decompression and discectomy. You can see the image here, the decompression and subsequently discectomy. The post-op MRI was performed. This is post-op 1 month after the surgery. You can see that that there was a sufficient decompression of the L5S1 with a capacious interlaminar space and decompression. You can see the facet is largely preserved and the disc has been removed, the sequestrated fragment has been removed. And a further MRI in 2 months show that there's further increment in the interlaminar disc space with no more sequestrated fragment. This is a picture of another patient of mine. You can see he had previous laminectomy scar, which is significantly larger than the current endoscopic scar, which is less than 1 cm in length. With a smaller scar, there's a less risk of wound complications. There are many patients in Singapore who suffer from spine conditions, such as degenerative spine conditions like spinal stenosis, spondylolisthesis, and for younger patients, and some of the older ones as well, prolapse intervertebral disc, thoracic and cervical problems. Many of these patients require spinal surgery as an intervention. Now, most of the surgery practice in spine surgery has evolved from open surgery to minimally invasive surgery. Such a practice calls for an intervention and the development of a spinal technique which requires the use of lighting, visualization, as well as fine instruments to deliver to the spinal canal and the spinal column to efficiently decompress the spine and also provide stabilization. Now, we can do this type of surgery through an open technique where there's more soft tissue damages, or we can do this using minimally invasive techniques such as endoscopic spine surgery. I went to South Korea in September 2019 to March 2020 as a fellow. I wish to learn the South Korean way of managing the spinal condition using minimally invasive techniques such as endoscopic spine surgery. And I went to Nanori Gangnam Hospital where I met Professor Hyu-sung Kim and his team of doctors, where I learned the latest technology of endoscopic spine surgery. His team see many Korean patients with spinal conditions, and they resolve 90% of their surgery through the endoscopic spinal surgery technique. What motivated me to go to South Korea is that they have a high volume of endoscopic spine surgery, and they are highly motivated and innovative in solving spine problem using the minimally invasive techniques. I think the Korean medical technology is very advanced and is very patient-centered. Many of the surgeries are catered to minimize soft tissue damages and yet at the same time allow sufficient decompression, and sometimes fusion surgery to be performed. My main interest in the Korean method is the latest techniques such as uniportal and biportal endoscopic spine surgery. I wish that the medical technology and the development of endoscope and its equipment can further advance the technology in spinal conditions. Endoscopic spine surgery will be, I hope that it can be more widely practiced both in South Korea and the rest of the world. As from my experience in endoscopic spine surgery so far, it has been a positive one with as good clinical outcomes and minimal soft tissue damages, as well as perioperative problems in my patients. I wish more people and surgeons can understand this technology and develop as well as adapt in their practice.